We're on your side tonight with a possible solution. We're talking about prescription drugs. Whether it's for heart disease, diabetes, asthma, or even ADHD, they can dramatically improve or even save our lives. But they can also be a burden because of the cost.
The medication cost is outlandish.
I'm going to be paying $3,500 to $5,000 just on my medicine needs.
What about people that can't afford it? Do they start taking their pills irregularly instead of every day, once a week?
Yeah, not taking your medications can be really dangerous, and yet millions of adults report not being able to because of the high prices they're dealing with. In fact, take a look at some of these numbers here. This is from a poll by KFF, formerly known as the Kaiser Family Foundation. They're really the leading health policy organization in the U.S., tracks this sort of stuff. It shows well over half, 61% of Americans, are on at least one prescription medication. 37% say they currently take 4 or more. 26% are worried about being able to afford them. 31% they limit how much they take that due to their costs. And they're not filling a prescription, they're skipping doses, they're cutting pills in half just to get by. 25% of those aged 65 and older say it is somewhat or very difficult to afford their prescription drugs. Now, one thing that helps them afford it all is Medicare.
Because senior citizens, they need their medication, especially us on fixed income, and it makes a big difference.
Tonight we're going to focus on Medicare Part D. That's the prescription drug component offering assistance to those with private plans. It helps pay for prescription drugs, both brand name and generic medications. And data shows in 2024, almost 1.8 million people in North Carolina were enrolled in Medicare Part D. In South Carolina, more than 966,000. Last year, people spent around $3,500 out of pocket for medications. But this year, out-of-pocket drug costs are capped at $2,000. That's all thanks to a provision in the Inflation Reduction Act, which narrowly passed in Congress in 2022.
This is a win-win for everybody across the country. Medicare can start getting a better deal for the American taxpayer and for seniors who are paying the highest prices at the pharmacy counter.
That's important because a report by the AARP reveals that prices for top prescription drugs covered under Medicare Part D have nearly doubled since they first hit the market. Carice Jackman has the story.
Cindy and Greg Mears know the importance of quality health care, not just as patients, but as lifelong professionals in the field. Greg as an emergency physician, Cindy in healthcare policy.
Healthcare's changed a lot. Where it used to be you had a physician and a patient and there was a physician-patient relationship, and that physician was working with the patient to guide them through the process.
They've also experienced firsthand the burden of rising prescription costs.
I experienced that frequently.
But what we've also seen is that the pharmaceutical companies are now pricing not based on what the actual cost of development of that drug is. They're pricing it based on change of life, cost of years per life saved, or benefits.
The AARP has been monitoring the increase in drug costs for years, particularly under Medicare Part D.
Unfortunately, what we have been hearing about and why AARP has been so engaged on this issue is that there are people who are having to choose between the prescription drugs that they need and other important things like their food or their rent.
The AARP Spotlight Report found that list prices for 25 top Medicare Part D drugs, which currently aren't included in Medicare drug price negotiations, have increased by an average of 98%. These findings highlight why AARP's Lee Purvis feels the Inflation Reduction Act of 2022 is so important. It includes a provision designed to combat high prescription cost. The first provision allows Medicare to negotiate the prices of certain high-cost prescription drugs. 10 have already been selected, with more to be added each year.
Unfortunately, I have a lot of stories from people who have reached out to me because they've been struggling to afford their prescription drugs. And our position has always been that no one should have to make those types of decisions.
Purvis says once the law is implemented, the first negotiated prices will go into effect in 2026.
Carice Jackman is reporting there. Officials say the new prices could save taxpayers $6 billion, while Medicare enrollees will save $1.5 billion in out-of-pocket costs. Some drug makers have sued the federal government to try to stop the Medicare negotiation process. Those legal challenges still making their way through the courts. Coming up next here,